So why do so many men struggle with social skills? Why do so many men struggle to understand women? And why are so many men isolated and lonely today? And why are so many men hypersensitive? So these are questions that come up regularly with nice guys I work with. And some then ask me, does this mean that I'm on the autism spectrum? Is this part of my wiring? Welcome to the Nice Guy Show. I'm your host, Ari Graff, and I'm joined by my co-hosts, Faisal Khokhar and Chuck Chapman. The three of us are coaches dedicated to helping nice guys because we are recovering nice guys ourselves. Together, we have decades of experience helping men level up. Our mission is to help men develop the confidence and the skills to get the love, sex, and success that they desire. So I'm gonna get a little nerdy with you. I'm gonna give you a brief history of autism because when we're talking about something like autism, I think we need to have sort of a shared frame of reference and understand the scientific background of it. So the term autism that was coined in the early 1900s to describe the social withdrawal and detachment from reality that are symptoms of schizophrenia. So originally it was associated with schizophrenia, which now we know is a severe type of mental illness. Then in the 1940s, the term early infantile autism was identified as a unique syndrome that included social aloofness, communication difficulties, and repetitive behaviors. So I think that's when we realized that this is something that shows up early in life. And around that time in the 1940s, the term Asperger's syndrome was developed to describe children with similar types of traits, but who had better language and intellectual abilities. Asperger's syndrome, we've retired, we've sent to the garbage heap of diagnoses, but it was an influential one. So by the 1980s, then it became clear that people with autism varied in their level of impairment. So some had pretty severe impairment and were low functioning, needing support in just about every area of life. Maybe need help being fed. Um, need help with every aspect of their day. And then other people they realize were high functioning. Who probably blend in with the quote unquote normal population most of the time. So that's when this idea of a spectrum came into being. It was around the 1980s. And then finally in the 2000s, the actual psychiatric diagnosis was changed to autism spectrum disorder to reflect that idea of that there's a continuum of symptoms and severity. So that's my little crash course in autism spectrum disorder. So another thing that you should know about autism spectrum disorder, it's a neurodevelopmental disorder. That means it's neurologically based. It is based in your wiring, and it shows up in early childhood. So you usually will see signs of it around age 1 or 2. So it's not something that just shows up in adulthood. So now I'm gonna share with you the current symptom criteria of autism spectrum disorder. So again, I'm getting a little bit in the weeds, but if we're thinking about autism spectrum and nice guy syndrome, we want to be really clear about what we're talking about. So as you listen to these symptoms of autism spectrum disorder, think about if they fit nice guy syndrome. So the first, there's kind of two categories of symptoms to meet the criteria for autism spectrum disorder. The first one is deficits in social communication and social interaction. So that includes deficits in social emotional reciprocity. So abnormal social approach and failure of back and forth conversation, failure to initiate or respond in social interactions, reduced sharing of interests or emotions. So deficits in nonverbal communication. So that's things like abnormalities in eye contact, body language, and then deficits in developing, maintaining, and understanding relationships. and adjusting your behavior based on different social contexts. So that's just the first set of behaviors in autism spectrum. So we're going to get out of the weeds in a second. The second set is restricted repetitive patterns of behavior, interests, or activities. So you got to have two or more of these. So one is repetitive or stereotype motor movements. So that could be things like hand flapping that we associate with autism spectrum. Insistence on sameness. So, or inflexible adherence to routines. And then we've got highly restricted, fixated interests that are abnormal in intensity or focus. So that could be somebody who's really into trains. And then the last one is hyper or hyporeactivity to sensory input. So sometimes we see this in people who are really sensitive to loud noises or certain smells or textures, or they're really attracted to those things, attracted to certain types of sensory stimuli. So as you guys are listening to that, do you hear the similarities between autism spectrum disorder and nice guy syndrome? I know it's a lot of information.
Well, I was like, okay, check. I was just taking them. I'm thinking, yeah, but are we a spectrum of pretty much most things that the American Board of Psychology creates? Because I was watching a documentary about, how the more diagnoses that we have, the more, they'll, the psychiatrist will do well with the big. I'm getting into the weeds, and I'm completely diverging here. But
Go
yeah,
ahead.
so
I've already
yeah.
led us into the weeds. Go
But
further.
yeah,
Yeah.
so there was an interesting something I was watching on YouTube, that how a lot of the diagnoses are done by the psychiatrists rather than psychologists. And what was happening is, because the more boxes that you have this condition, you have this condition, the more conditions that they were creating, a lot more conditions than ever before. And because of that, there were people, oh no, I've got this condition. Oh yeah, that's me too, and that's me too. I need this medicine. I need this medicine. I need this. So you can see there was a great chain of like trying to get us to tick so many boxes and recognize that these are all syndromes or disorders I have that I need to get fixed.
Like we're pathologizing all kinds of behavior.
We're pathologizing just human beings. They are, like the average person will probably come under every single syndrome. It's like when you go on Google, right? And I've got a bit of pain here. Well, it could be this. It could be. You come back from Google and you've got like 1,000 diseases that it could be, right? And it's the same thing with psychology. Well, you have this disorder, this disorder, this disorder. I can fit into like 100 disorders by one symptom. And then what I've found is that my overthinking, ruminating brain wants to associate and find all these disorders that I have. And then because I don't feel enough, that shame in me thinking, well, I need to fix this. Otherwise, if I'm not fixed, if I'm not perfect, there's something wrong and flawed with me. And because it's flawed with me, I won't be good enough. If I'm not good enough, I won't be loved. Right? So there I'm in this cycle thinking, okay, there's a lot of fixes. But how I see it is, we're a software and hardware that's very ancient, very legacy system is called in technology, that our updates take a long time to develop. Our programming takes a long time to develop. So we will have a lot of, I would say, bugs, not great software that needs a lot of work to it. So therefore, most people will have a lot of stuff. I mean, what you've described is, I know everyone who would have one of those symptoms.
And I think that, yeah, I mean, I have a couple of different perspectives of this. One is all mental illness is just regular behavior gone to a point in which it's affecting your life in a negative way. you know. So we've all experienced the blues and depression. We've all experienced, you know, being at a party and wondering if, oh, are those people talking about me? So we've experienced paranoia. We've all experienced maybe being in a crowd and thinking that somebody, you know, we heard our name shouted or something like that. And welcome to hallucinations. You know, we all have these things that are, when they become overwhelming, when I'm always hearing a voice, when I'm always paranoid, then it becomes a mental illness. So I think a similar kind of thing with autism, that it is regular normal behavior in some ways, but it's when it starts affecting you in negative ways. I took a test online, you know, because it was like, kind of like an autism test. Are you autistic? And I think it was, I can't remember the criteria, but it was something like this. You needed to score 25 points to be on the spectrum. And I scored like 23, you know, so it was like, okay, I'm not on the spectrum, but I'm really close. So what does that mean? And it's just, and then the second thing I think that is true is that we are seeing an increase in diagnosis of autism. Does that mean that that's the criteria is getting lower for it, or does it mean that there is an increase of autism? And I kind of think that, you know, my wife's in special education, and so she knows a lot about autism and that kind of thing. I think there is a trend that autism is increasing, but I don't think it's for the reasons that we think it is. I think it's actually an evolutionary change in our humanity. At a psychologist or psychiatrist friend of mine who used to work up in Washington State, and he was telling me that at Microsoft, one of the benefits of working for Microsoft is they provide daycares for your kids. And of course, many people that work there have many different, you know, multiple daycares, but they have daycares specifically for kids with autism, because when you look at the pool of people who are working at Microsoft, there's a higher level of people who are going to have those sort of autistic types of qualities. And I think that there's you know, as we're getting more and more into technology and the way that we live, we need less and less of our, you know, even our emotional senses and things. So I think there's also a part of autism that is actually just moving us into the next spectrum of our evolutionary track. So it'll be interesting to see when we come back in, you know, a couple hundred years or 1,000 years to see what people would be like from now. They're all going to be around wearing pocket protectors and looking at their shoes.
Revenge of the Nerds.
Right. Yeah.
There'll be AI.
Yeah.
Yeah,
That's true.
yeah. And I met
Well,
I met a guy the other in a conference a few weeks ago, and he says that he specializes in hiring people with disorders because what he found was they were very they might not be good at the social aspect of it, but they were very competent, very genius in their jobs. So he would have some people who would be, you know, really good with numbers. You know, they wouldn't be able to have any kind of social skills. He said that was the most difficult part. But when you gave them a task to do, they would, you know, they would really focus on that. And I think that's probably what the evolution adaptation of humans is, that, you know, there are parts where we don't need emotions. We don't need any kind of, we just need a worker bee who will just do the job in the most efficient way. And I think that's one of the evolutions of why we have that spectrum, possibly.
Well, what we're talking about here is a trend that's been around for about 25 years called neurodiversity. So you hear more and more people now talk about being neurodivergent, and that includes conditions like ADHD, autism spectrum, dyslexia, and even I was looking at online about this, that, you know, social anxiety disorder, obsessive compulsive disorder, which, you know, I think we typically put in the, you know, mental illness, more psychiatric, um, emotionally based disorder. Those are also in the category of neurodivergent. Um, one of the I think helpful things about this neurodiversity movement is that it's more strengths based and less about your deficits. So I think that's what you guys have both been talking about, like that, you know, we can find niches for people who may have difficulties with social situations or social awareness, but they have other strengths. So I think it's a good thing that we're focusing more on the strengths of neurodiverse people, including people on the autism spectrum. I think that we also don't want to, this is my opinion, don't want to go overboard, um, only focused on their strengths, because a lot of them are suffering, because of their social difficulties. And they need support for that, not just accommodation of it. Um, and this is something that to get back to nice guys, um, one of the things that we do coaching nice guys is help them with their social skills. So social skills can definitely be trained. But to answer the question that I started this whole episode with, no, um, nice guys are not on the autism spectrum. Now, you could be on the autism spectrum, and that could be a risk factor for developing nice guy syndrome. But the social difficulties that most nice guys have are not due to being on the autism spectrum. These are not necessarily neurologically based. These are more based in your early relationships with caregivers. So um, you can have both. Like Chuck talked about having ADHD and how that was a source of toxic shame. So I think being on the autism spectrum, and because of all the challenges just dealing with the world on the autism spectrum, initiating conversation, participating in conversation, creating relationships, there's all kinds of ways you can experience toxic shame. So, that's how autism spectrum can set you up to be a nice guy, because, when you don't know how to deal with the social world, you're going to be more likely to submit to others just to get along. So I think that's how they're connected. But, too many people are diagnosing themselves based on WebMD, to get back to what Faisal was bringing up earlier. So yeah, I've had trouble starting conversations. I've had trouble forming friendships. It doesn't mean I'm on the spectrum. So I could have a lot of symptoms that are part of autism spectrum disorder, but not be on the spectrum at all. And that's where you really do need an expert to diagnose you. Um,
I've also worked with guys in my clinical practice that have been on the spectrum, autism, and there's a there there's two things I think that they discovers. One is kind of going back to the idea of like the toxic shame, feeling different their entire life, but not really knowing why. Knowing that they have difficulty with social interactions, but not really knowing why, and that oftentimes these guys, when they get a diagnosis of autism, it actually is freeing to them, because they're like, oh, okay, this doesn't mean there's something morally wrong with me or something like that. It's like my brain is just different, hardwired different than other people, and just the diagnosis itself can be very normalizing in a way, the neurodivergency, which then kind of starts to help with some of the symptoms that they, like it's like, just being able to talk about that with people, giving them the power of, I remember one client where he just kind of like, when he meets somebody new after, you know, a little while, he'll introduce the subject of autism and say, he'll talk about him being on the spectrum, and that, why maybe he has some difficulties, in conversations or whatever, that he's just kind of upfront with it. And people are generally like really accepting, and they're like, oh, okay, well, that makes sense to me, instead of, what's wrong with this guy? Why is he so weird? And so I think it's a good thing that more and more people are being diagnosed with autism. And so certainly there's nice guys out there who have, a lot of the developmental kind of symptoms of the nice guy, the fundamental thing of feeling unlovable and unacceptable just the way that you are, plays into that when they've grown up and they haven't felt lovable and acceptable, and they see themselves on the outside, that it's more of a cause of the autism, but then they start developing the nice guy behaviors around that as well.
It's
So,
good that it's good that your client was able to express, hey, this is where I am at. And as soon as you know your enemy, then you know the
yeah.
tactics, how to work around
Mhm.
it. So even I remember even my ex-wife saying, she said, I think you've got Asperger's and I think you've got autism. I'm like, okay, great. Anything else? And she goes, yeah, well, I think, and I'm like, okay, whoa, whoa, whoa. There's a lot of diagnosis coming out, and I find that especially nowadays that that we're all doctors, we're all psychologists, we're all this, and we're happy go diagnosing everybody else, and then I've got this problem and you got this problem. He's a narcissist. This is gaslighting, and I think that it's becoming quite neurotic out there.
Yeah.
Yeah, people. This is a frustration of mine. People throw around diagnoses and labels very, very casually, very loosely, and I think that can cause a lot of harm. And then they use it on themselves very loosely too. So, but like Chuck was saying, having a diagnostic label that's correctly made, and I spent much of my life as a psychologist doing evaluations, so this was my business. So it is freeing for people a lot of the time to get a diagnosis. Just like I think a lot of nice guys, when they read No More Mr. Nice Guy, it's freeing to get this idea of nice guy syndrome. Um, because then you really feel understood and that you're not alone and that
It's
there are
that certainty,
reasons
isn't it? It's
there's
that
reasons
certainty.
for your struggles. Yeah. So,
Yeah.
most people have mixed feelings about diagnostic labels, but they do serve a purpose. We don't want to box people in, but oftentimes when people get a label, um, then it's something that they can start owning those pieces of themselves and seeing themselves in a more positive, non-judgmental light, and that's how they start moving forward and making positive changes.
I like boxes. I think this yeah, because a box tells me what I'm working with, right? Speaking of labels, I've created my own framework as well. The five
Plug,
masculine
plug, plug.
fractures. Yeah,
Yeah.
exactly. Yeah, and again, I'm like you could have that fracture. You could be on here. You could be on here. You know, but again, it helps when we have a roadmap, when we have that certainty. It's like, okay, this is what I'm working with, and we need that certainty. It's that uncertainty of like, okay, I'm struggling with socializing. I'm going out. I don't have the eye contact. What's wrong with me? And when no one can give a concrete answer, and that's where the lot of problem comes. And also, when you do get the answer, but you don't actually seek the solutions, then you go back again being stuck. And okay, I know what I am, but I'm still stuck with it. So you need to, one, get that certainty, but also work with it and really, like, for example, social skills, and you were talking about, um, being very difficult to articulate, start a conversation, understanding. Those are the things I really struggle with because it was easier for me to spend time with computer and technology than it was with human beings. So when you're going back out, I spent 2 years nonstop, 4 times a week on average, going out and honing that skill in because I said social skills are going to be so important. And I'm feeling lonely. I don't have these connections. I don't know really how to speak to people, talk to people, understand people. So rather than saying this is a problem, I'm saying, okay, let's overwork this. How do we solve this and get to a place where we can solve this? Again, so with some of the guys in my clinic coaching practice, when they work on this consistently, they overcome some of the biological or natural limitations that they have.
Another thing I was just thinking of is that you, you can take the symptoms of a nice guy and you can say, oh, these are autistic symptoms, but you can also take the identifying factors of the integrated man, and you can look at people with autism and say they have that too, because one of the things that people with autism, they're very clear and direct. They very much like tell you what they're thinking at any time. They're not sugarcoating. They're not trying to get you to like them necessarily. They're just trying to make sense of why you're doing something. So I think I love working with guys that are on the spectrum, because they are very clear and direct, and they'll tell you what they're thinking, and they're not hiding things and trying to get people to like them necessarily. They're just like, oh, this is me, of course I'm going to tell you that, to buzz off or something. and I was having this conversation with my wife. She was talking about a kid who had autism, and she was working with him, and she says, okay, so here's the scenario. Your friend gets a new pair of glasses and you don't like them very much. What do you say to your friend? And when your friend says, how do you like my new glasses? And the kid with autism says, those are ugly glasses. And she's like, no, you don't say that. That's not socially acceptable. You have to say, oh, those are very nice. And I'm like, you're teaching them to lie. That's not, like, it's the actual opposite of like, great. He just, he spoke his truth. But I think there's a balance somewhere in between there of being able to speak your truth with kindness, but without having to like lie just to be socially accepted. Anyway.
It is.
Nice,
It's
nice
a
shirt.
skill. Nice shirt. Yeah.
Yeah, nice shirt, Chuck.
Thanks. Yeah.
It's a skill to be able to adjust how you behave according to social context. It is a skill, and that is something that people on the autism spectrum struggle with. So, I don't believe it's adaptive to be honest in all situations.
This is the awkward silence bit now.
This is where we wrap it up.
Yeah,
the integrated man can deal with an awkward silence. All right. This has been a great discussion. I want to talk more about social skills with you guys. So thanks again for being part of the Nice Guy Show. If you like this podcast episode, check out episode number 54. Is ADHD part of my nice guy syndrome? It's kind of a companion piece to what we talked about today. So if you're watching this on YouTube, remember to like and subscribe, because this helps us to reach out to more men who need support. Or if you're listening to us on your favorite podcast platform, make sure to subscribe there as well. Go to niceguyshow.com to get on the mailing list, and we'll see you next time.
You've been listening to The Nice Guy Show with certified Nice Guy recovery coaches Ari Graff, Chuck Chapman, and Faisal Khokhar. Be sure to subscribe to this channel so you can listen to our latest episodes, and visit us on www.theniceguyShow.com. If you have any topics you'd like to hear us discuss, send us an email at support@theniceguyShow.com. Thanks for listening.